apparently it definitely is happening in some states, and according to this new research done by folks with George Washington University, Utah is on a list of states, nearly 24 of which could fall into that category, supplying enough doctors to intensive care units right in the middle of this very deadly coronavirus pandemic. Now, the details of the study, it comes from our content sharing partners at Newsy, and according to this study, 3 states in the South are already short on doctors, and Utah joins 22 other states across the nation that are on the brink of a shortage. The research team at George Washington U, they put together a state hospital workforce estimator to help healthcare workers weigh their state's cases compared to the available resources.
The virus is not affecting states sort of in an equal way at the same time. It's easy to set up new beds, as we saw in New York and Central Park, but it's not easy to train up these professionals. You actually have to have policies in place in anticipation to be able to get them to where they need to be.
So some possible solutions, according to the researchers, they suggest struggling states contract with out-of-state workers to come in and work there. Also, to temporarily allow retired doctors to return to the workforce, and also to transition final year med students into practice. They also suggest easing restrictions on telehealth visits to potentially minimize the in-person contact in the ICU between doctors and patients. So we're not there yet in terms of a shortage, but the warning signs are there. And again, there are some possible solutions as well. For now, we're live in Salt Lake City. Scott McCain, Fox 13 News, Utah.